trunk flexion. It's a curl. And is this an against gravity position? Yes. Okay. Ready?
Yes.
Now, looking at it, what would be an against gravity position? I mean, gravity eliminated position.
Would it be sideline?
Sideline. Would you be asking him to do the same maneuver?
No.
Yes or no? If you're looking at the abdominal muscles itself, would you be asking him to do the same maneuver as a trunk curl? Yeah, you'll be going off the table. All right. Can you sort of really instruct him in a way, don't go off the table now, if he's in a sideline position? No, I mean, it's just really not a comfortable position, no matter how you position the arm on it. So when we're looking at the trunk muscles, we're gonna be using the same position, okay? Supine, right? What we're gonna be looking at is the positioning of the arms, okay? Right? Because different positions of the arm will make it slightly easier or harder depending where the arms are, right? And how much you actually get this person to lift off the table, right? So when we're talking about a trunk curl, right? What definitely has to come off the table?
Shoulder blades.
The whole trunk or just half the trunk?
Shoulder
If we're just
blades.
looking off the half, so
Shoulder blades. The
shoulder
scapula.
blades, okay? So shoulder blades, okay?
Yeah.
So we're looking for the shoulder blades to come off the table in a nice, smooth, controlled manner, right? So if you've seen people in the gym sort of struggling along, right, trying to get it all the way up, you know, get the trunk up, get the shoulder blades off and all that, right? That's gonna tell you, saying, oh, okay, not quite good, right, if they're struggling. What we're looking at is the consistency of the movement and the smoothness of the movement when they're doing a trunk curl, when they're doing hyperextension, when we get to the recti spinae muscles, right? So that's what we're gonna be looking at. Positioning of the arms, okay? Smoothness of the movement, and actually how much do they get off. Typically, when you instruct them to do a curl, what position should their lower extremities be in?
Extended.
Extended. It should be extended. Now, if you are seeing them struggle, all right, if you have a patient really is struggling along, but they're trying, what you can do is to bend their knees, okay, and have the feet flat on the bed, all right? But usually, I will have the legs straight. For you guys practicing, if you know you are weak, okay, start with the knees bent, okay? Just start with the bent, just to protect yourself. Yes or no? Okay. All right. So, we're looking at trunk flexion. You're looking at the rectus, right, internal and external obliques on both sides, okay? A little bit transverse or not really? Do you think we're actually getting the transverse abdominis when we're doing this thing?
A little bit.
Oh, smidgen, not even a little bit, less than a little. Alrighty, when we're doing trunk flexion with a curl, we're working on the superficial muscles. There is a specific way of trying to contract your transverse abdominis, and I'll show you guys how to do it. It's not going to be on the practical, but this is something for your sake. See if it actually works or not. See if you actually are able to contract your transverse abdominis, because it is difficult to do, okay? Because when you even tell them the proper instructions, people just tend to get the rectus guide come in.
How would you not feel your transverse if you work your transverse when you exhale and when you work now, right? So when you come up and you exhale.
No, exhale is when you're exhaling.
Because your transverse is a forceful exhaler.
Do we forcefully exhale all the time?
But when you work out, like if you do like a sit up, you come up when you breathe out. Or would you not use your transverse?
Okay, you're talking about the breathing aspect of it. Yeah, you're probably getting it a little bit, but you're not getting a fiber where you're actually contracting the muscle in full force, right? Right? But, you know, when you're blowing out, are you doing this like that? No. But when you exhale, what do? if you're actually inhaling and exhaling when you are exercising, right? So you're sighing.
Oh, that's
You're sighing.
Oh, the sigh.
Alrighty? And so a forceful exhale, right? Think of it as the precursor to a cough. So what's a cough, really? An explosive exhale.
Yeah.
Okay, an explosive exhale. Alrighty? So when you're exhaling, is exhaling, remember from A and P, is that passive or active?
Most of the
Passive.
time it's passive.
It's passive,
But you
okay?
could make it active.
Right? The only time your diaphragm, okay, is coming into play, that's an inspirator, alright? That's for inspiration, okay? That's always active, and you want that because you want to be breathing. But exhalation is an active, is a passive activity, okay? Goes, because it's looking at the pressures of your intrathoracic cavity and
Breathing.
compared to just right outside the thoracic cavity activity, right? So the only time that you will see somebody use a forceful exhaling technique is, say, the marathoners, alright? No, not you, but marathoners. They are huffing and puffing at the finish line, aren't they?
Yeah.
That's when they use it.
When tennis when you
COPD
need
is
'em.
huffing and puffing, okay? That's when they're using those muscles, okay? Alright, back to this. Alright, so let's start with uncross your legs.
There he is,
Now,
huffing and puffing.
if he really, really wants a pillow, I will give him a pillow. But should he have a pillow? No. Okay. You okay without a pillow? Okay. Alright, so you're looking at positioning of the arms now, okay? So how we're gonna do this is positioning arms. First grade, okay? Arms at the side, that's the easiest thing to do. That's gonna be considered a 3 out of 5. Arms across the chest is a 4 out of 5. 5 out of 5 is hands behind the head. Try not to interlock your fingers, because what do people tend to do when they interlock their fingers? They
Lift up
pull,
their
they yank their head off the bed. So just one of these things, okay? Alright? And not this either, okay? As best as possible. Alrighty, so just can you stick your arms out to the side, okay, like this. Put your head down, okay? What I want you to slowly do now, okay, is reach for your knees with the hands and bringing your trunk up at the same time. Can you do that for me? Yeah, like that, alright? You can put your arms here. Try not to raise them all the way up, okay? Alright, so on the count of 3, 1, 2, 3, bring it up, good. And he's really strong because he's strong, right? He came up further, alrighty, than he needed to for 3 out of 5, okay? So what you really want to look at is the nice control of everything, alrighty? Now, what would you sort of look out for if they're like, nah, they're 3, but not a great 3 out of 5?
Arching the back.
Hmm?
Arching the back.
Arching their back a little bit. What else? What else might they do
Lift
to
up
try
their
to
legs.
get them up? Legs coming up. What else?
Shaking.
Twist.
A little shaking. What would their upper extremities may do?
Go up.
Twist.
What do you mean by twist?
Because instead of rectus abdominis, they use a lot more of the.
Oh, okay. They could do that. Yeah, they could twist a little bit. What else? What if they're really weak? What else may they try to do to impress you? That yeah, I'm strong. Yeah, I'm strong.
Hands are coming up.
Hands are coming up, and they might be grasping. Okay? People tend to grasp like their pants, shorts, whatever, whatever. The bed. Okay? Push down on the bed. Okay? So you want to watch out for those compensation techniques. Okay? And because we want to keep their hand at the side, you don't want their arms resting totally 100%. Because they'll tend to grab everything at that point, but you don't want their arms all the way up either. Alright, so it's somewhere in between. Okay? Now if I saw him really arching his back, I would bend his knees. Okay? Just to help support him a little bit better. But you always really want to start them in lower extremities extended position. So if you're gonna, can you cross your arms for me now? Right, so on the count of 3, can you bring it up? 1, 2, 3. Good. And he's strong. He's pretty strong. And bring it back down. Okay? Alright? Now, this time I'm going to do it. So if I want to palpate for the muscles, where would my hand be? The rectus abdominis.
there's
And the
like
xiphoid?
process.
The side-by process, okay? I'm gonna just put my hand right over here. Is that okay with you? Can you do it one more time? While you're doing this, try not to hold your breath and bring it back down. Okay? Try not to hold your breath, okay? Good trick to do, ask them to count with you, something like that, because most people will tend to hold their breath when you're doing this, okay? Remember, it's not the breath holding that's a bad thing, it's the release afterwards, okay? Why?
All the blood rushes.
Blood's rushing back, okay? Because when you hold your breath, basically you're doing a what kind of maneuver? You guys did?
Valsalva.
Valsalva. You're doing a Valsalva. You're bearing down, shutting everything down. Alrighty? All of a sudden you let go, blood starts rushing back, and it's
Pass out.
your brain and your heart is not used to it, right? It throws off the equilibrium for a few seconds, and for people who have comorbidities, certain comorbidities, that can be bad, right? And that's when you hear people, getting dizzy, passing out in the bathroom kind of thing, right? Right, so for a 5 out of 5 band, hands behind your back, okay? Now can you bring it up for me? All right, good. And bring it back down, all right? Want to palpate the muscles one more time, bring it up, all right? Best you can not to bring the elbows in like this, all right? I mean, listen, I'm not gonna have a ruler there, all right? But you want to instruct your patient, keep your arms as flat as you can. Sometimes if you instruct them to retract their shoulder blades a little bit while they're doing it, it's a good hint, all right? Pinch your shoulder blades and come on up. Right? And again, we're looking for the control of the motion and how much they brought up. And for him, he got his shoulder blades off, right? So that would be, I would consider that a 5 out of 5 for him. Yes or no? Okay? Now, so if he was really, really weak, okay, what do you think you would see?
You would flex his neck.
Flex his neck. Okay, what else? Would his trunk come off? No. So for when you're testing a gravity eliminated position, hands are gonna be at the side, okay? Alright, and just come up a little bit, like just bring your shoulders off. Something like this, alrighty? Would be considered a gravity eliminated because he's not contracting his entire upper half of the rectus abdominis now. All those fibers are not coming together to get those actin and myosin guys. Yes or no? Alrighty? Yeah, good? Alright, so what would I instruct him to do? How would I instruct him to do a trunk curl? A trunk curl to the right side. What would I tell him to do?
Reach for your left hand with your left hand. Well, no, reach for your right knee with your left hand.
Yeah.
Reach for your right knee with your left hand. Okay. Alrighty? Okay, so that's good. So this time I want you to come up. Alrighty? Oh, wait for me. Alrighty? Wait for me. Starting, this is again, same position with the hands, okay? For a 3 out of 5. Alrighty? While you're coming up, right, can you just come up and reach with your left hand towards your right knee on the count of 3. 1, 2, 3. Good. And did good. So would you consider that a grade of 3 out of, this would be considered a grade of 3 out of 5. Be aware that I didn't see anything over here. Was he leaning down?
I don't know.
Let's try it again. All right, 1, 2, 3. Good.
No.
Okay. What you can sort of make sure he doesn't reach, both hands reaching towards the right side of the room. Okay? You wanna try that? Both hands reaching towards the right side. Good. And down. Right? So for 4 out of 5, hands across the chest. Okay? Same maneuver. Now you want and go towards your right side. Yeah. 1, 2, 3. And back. Did you guys see the leg come up a little bit? Alrighty. So, alrighty. You okay to try it one more time? Alright. Now where would I place my hands to palpate, you think? For the muscle action. Both sides. I would have both hands in this kind of fashion. Alright, so on the count of 3, can you bring it up? 1, 2, 3. Good. Alright, you want to bend your knees or not? You're good. Okay. It's up to you, yeah? You're good. Alrighty, his hands would be for a 5 out of 5. Okay? On the back. Okay, try, and what would I tell him? to do.
Don't interlock your fingers and don't bring your elbows together.
Don't bring your elbows together, and
Don't
how would you
interlock.
make them go to the right side?
Oh, reach for your right knee with both. Well, point towards your right.
Left elbow, point your left elbow towards
Your
your
right
right
knee.
knee for me, okay? Alrighty, also on the count of 3, 1, 2, 3, good, and back. Ooh, bend your knees. Alrighty, let's try that one more time, on the count of 3, 1, 2, 3, a little bit better, okay? Alright, a little bit better, yeah, good? Alright, and again, for when you're looking at, for gravity, we'll do gravity eliminated in a minute, okay? Because I think I even showed it to you already on Tuesday, where we were sitting, and we did a twisting, alright? Okay, we'll show it again. I will show it again. Alrighty, so, when we were doing these trunk curls here, alrighty?
Here's gravity.
Alrighty, we were primarily looking at the upper 3/4 of the abdominal muscles, your rectus abdominis muscle, the upper 3/4 half, okay? Now, really did not look at the lower part of your rectus abdominis, okay? Because remember, your rectus abdominis goes from the xiphoid process to where? Pubic symphysis, okay? This little guy really does not get to work out the lower half at all, the lower part at all. So, what's the best way to teach you guys how to do it? And again, we're gonna see how strong all you guys are. You guys can try this, okay? What I'm gonna ask you to do is basically contract your lower abdominals, right? Don't do it yet, alrighty? By sort of lifting your buttocks slightly off the bed, okay? So, can you bend your knees, bring it up to 90-90. Feet off the bed, feet off the bed. Okay, bend your knees now. 90, oh, you can't? Okay, are you okay? Are you okay?
I didn't understand what you were
Okay, 90-90 like this, okay? Now, I don't want you pushing up or anything like that, like using your legs to push up. What I want you to sort of focus on is contracting or tightening up your lower abdominal and just lifting your butt off slightly, okay? Alright, so on the count of 3, just slowly, like sort of, think of your knees being pulled up by your abdominal muscles, okay? Yeah, like that. Okay, put your head down though. Put your head down though, good. Alrighty, so try it one more time. Good, and that is all you're doing. Alrighty, because you are contracting only the lower abdominal part. You actually did pretty good.
Really?
You actually did pretty good. You were able to at least contract the muscles. Alrighty, because what activity really do we do that, you know, works on the last 2 squares of your rectus abdominis, those bottom 2 squares, right? When we do a curl, where do we work on?
The top.
We work on these guys, the big 4 right here, the nice 4. Down here, we really don't work on them, okay? Right? So, you know, you guys can try this, because a lot of people, when I've tested in the past, on students in the past, bend your knees up, alrighty? Just lift your butt up. A lot of people just sort of tend to lift their butt up, like they push themselves up. You have good glutes, right? But not really working on this lower abdominal muscles itself, okay? Like I said, I'm not gonna be testing this on the practical, but this is a little information for you, alright? To see how really strong you are in the lower abdominal muscles. Yes or no? Okay. You good? Okay, let us do, can you sit up for me? Okay, you can face them. Alrighty. Okay, let's see. Alrighty. Should you be using this on a patient, by the way, a rolling chair? No, we're gonna use it just because we have nothing else. Alrighty, and you do want the legs as possible, to like a 90-degree position, like the hip at a 90-degree position. He's a little bit too high right now, okay? So, can we push back a little bit? Does that work? Extend your legs a little, just like, yeah, okay. Okay, that works a little bit better. Alrighty, so what I want you to do now you can put your hands on your hips like this, or like this. It's whatever you're comfortable with, okay? Right, and what I'm gonna ask him to do, since we were doing towards the right, is this a gravity eliminated position or gravity minimized position for his abdominal muscles? Yeah.
Yep.
So what would I ask him to do? Well, if he did that, is that going into gravity now?
Yes.
Alrighty. So would I be able to really test gravity eliminated? No, because gravity's helping him for regular trunk flexion. That's why we only use the amount of distance that he lifts up and the control that and how much control he lifts up for a gravity eliminated position. For here, for trunk rotation, we can actually test for a gravity eliminated, okay? Because this is gravity eliminated for your trunk muscles, okay? Because if I'm gonna ask him, if he's rotating to the right, I'm gonna palpate for the muscles, righty? And can you just sort of turn your trunk towards the right, towards me, on the count of 3, and back. And I would feel his oblique muscles working. 1, 2, 3, and good. And you again, look at the amount of motion, look at the control of the movement when he's doing this. Yes or no? Good? Hey, you okay to do the trunk, the rectus spinae?
That was gravity eliminated for trunk rotation.
For trunk rotation, okay? Alrighty, not for trunk flexion.
Trunk flexion when he just barely got up.
He barely gets up, like say top of the shoulder blades, top of the scapula, alrighty? Because there's no way of getting him to be able to do trunk flexion in a sideline.
Would
You guys can try that later.
Would you have them bend their knees for gravity minimized?
Well, when you have them bend the knees, it's more controlling the hip flexion component of a trunk curl. Alrighty.
So it's just
So
not
I mean,
iso-
it
it's
just
just
makes
not-
them a little bit more comfortable.
Mhm.
Alright, because when you're doing this, when you're doing a sit up, can you stretch your lower lumbar spine?
Yeah.
Can you? Yeah, possible. Alrighty. So that's why I will test them either with their legs extended first. Alrighty, and I see them arching a lot or they're having discomfort doing it, I will bend their knees and then test it. Okay? Right.
He barely got up.
Alright, now looking trunk range of motion. Is there any way for me to do trunk passive range of motion? For me to do it.
No,
For me to do it.
not really.
No. I mean, it's pretty much a person's upper half of the body, yeah. It's half their weight that I would be doing it, okay? For the cervical spine, yes, but for the trunk, no. Okay? Alrighty, so, can you go prone for me? Alrighty. Thank you. Can you, can you take off your head for a second? Thank you. And can you bring your head off the bed? Okay. Alrighty, you good? My hand's here if you want to rest your head a little bit, okay? Now, what muscles are we looking at? The,
Linnaeus capitis?
what are these muscles called again?
The extension?
Yeah, the extensors or the erector spinae.
You're doing a trunk
Okay.
extension?
You doing?
Yeah, we're gonna do trunk extension here, okay? So, what I'm gonna ask you to do here, again, is looking at the positions of the arms, okay? There's 2 positions of the arms. The arms are gonna be out straight, or they'll be by the head, okay? So what I'm gonna ask you to do, can you just sort of lift your trunk up as high as you can. Try to keep your neck straight though, okay? Ready? On the count of 3, 1, 2, 3, go, 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 go. Oh, he's quite strong. He's quite strong. Alrighty, that was very good. And so what you're looking at, alrighty, is his ability to get close to the umbilicus of part of his trunk. Now, is that gonna be predicated on how much movement he has and the positioning of the spinous processes and all that? Can that interfere a little bit? Yeah. Alrighty, so what we're looking is, it doesn't have to be exactly at the umbilicus, right? But close enough that he gets pretty much half his trunk off the bed. Alright, so we'll try it again one more time for 3 out of 5. 1, 2, 3. Good. Nice. And good. Alright, So, and for, you good? You wanna put your head back up for a second? Okay, so if you are looking for a 4 out of 5 here, alrighty, you're looking at placing the hands behind the head, okay? Alright, come off the trunk though, come off the bed, okay? Hands behind the head, and jump down a little bit. You seem to be hyperextending already, are you? Yeah, okay, okay. Alrighty, so on the count of 3, come on up, 1, 2, 3. He's, okay, still pretty good. So he's definitely a 4 out of 5, okay? Can you, this time you do it, try to go as much as you can, okay? Alrighty, 1, 2, 3, go, 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 go. That's it. Still pretty good. Alrighty, so moving back. And how we're grading it is looking at his effort. From my advantage point, I didn't really see a lot of distress, right, when he was doing it. He didn't quite go as high as he did before with a 3 out of 5, right, with his hands at his side, but he did get close there. So I would say he's definitely between a 4 and a 5 out of 5, because his distance was a little bit less, no offense or anything like that, Joseph, a little bit less than, say, for the 3 out of 5. So I would give him a 4 out of 5, because we're looking at how close he is to that umbilicus. Yes? Question? You had a question.
Oh, I just wanted to know, why does the position of the upper extremity affect how well?
It's just looking at the leverage that you're using. It's looking at the leverage you're using.
So when you have your hands on your side, you have more leverage, supposedly?
Yeah. Yeah, you have more of the ability to give you that push.
Oh.
Okay? Alright, you're looking at the leverage. That's all. Questions? Okay? Alrighty. Okay? Now, again, looking at somebody who is very weak, okay, what do you think they would do? So that was for against gravity. What do you think they would do?
Lift their legs. Or bend their knees.
Right? Lift what?
Their lower extremity.
Lower extremities. What else?
Arch their back. Wait.
Arch their back.
They'll use their hands to push themselves.
They'll use their hands, okay? So what you're gonna do, you're gonna be stabilizing them more, okay? Alrighty, so I need a little help. You watch his head, okay? Alrighty, so I need to stabilize his hands here, alrighty? And he's gonna, just bring like barely up, okay? I'm gonna stabilize this and have him come up this way. On the count of 3, 1, 2, 3. Alrighty, and I would be stabilizing. If he was that weak, and he's really not that weak, because I'm not really needing to stabilize, alright? Because he was actually, do it one more time, Joseph? Alright, probably a little bit in his legs I needed, but his pelvis, not much came up. So you're looking at the amount of motion. Good? Alright, questions so far? Hey, you good? Okay, we'll do the neck. Now, for manual muscle testing, okay?
Can I ask you a
Look
question?
at,
Sorry. So for the back extension, we did 3 out of 5 and 4 out of 5.
5 out of 5 is just looking at how smooth it is, alright? Because again, functionally, if they are that weak, what would you see functionally? If they were doing like a functional activity like sitting?
Like
Oh,
slouching.
they might just like
Slouching?
plop down.
Slouch.
Slouching?
Yeah.
Oh,
What do you mean by plopping down?
like they won't have any like stabilization when they sit down. They're just sit. Does that even make sense?
Well,
That's more pause.
okay, that's more for when they're going into sitting,
Yeah.
but what happens when they're sitting?
They're slouching.
They're slouching, alrighty, they're leaning over to one side, they might be falling forward, God forbid, alrighty, because what's your trunk muscles, your anterior trunk muscles, rectus abdominis, and obliques, and your rectus spinalis really supposed to do when you're sitting?
Stabilize.
Hold you up.
Stabilize, hold you up when you're sitting, okay? Alrighty, because, let's see, Elizabeth is doing quite well right now. Alrighty, because everybody
It's
else
'cause I
was
just
slouching
corrected
or
it.
leaning onto the table.
Almost like.
Alrighty, alright, so she has relatively good strength functionally. Now, when I see people who's leaning over to too much to one side, alrighty, or actually not even leaning, falling over to one side, that's when I'm gonna be considering, I said, oh, let me see how really strong they are. Alrighty, get them in a supine and prone position, and test their strength of the rectus abdominis, the obliques, and the erector spinae muscles. See how strong they are. Because when you're saying, somebody did Down syndrome, right? Right? Well, layman's term, what do we call those kids? Floppy babies, right? Right?
So
Because
much.
why?
So they have
Weak muscle.
Low tone, so they're just like, saying something like this. Alrighty? And it's not because they put themselves in that position, right? They just sort of go into that position. Alright? So if I see them falling in, that's what I'm gonna be looking at, okay? If they're falling in, I'm gonna start testing them at that point to see how strong they actually are. Yes.
Did we do trunk hyperextension gravity eliminated? That was when he
Yeah.
barely went up?
Barely went up,
Oh, okay.
okay? You're just doing barely going up. Because what's a gravity eliminated position for him?
sideline.
Yeah.
Sideline.
Same thing as flexion.
Oh yeah, how am I gonna, is he gonna
Then
be
you have
actually
friction.
doing that?
Yeah.
Yeah.
And just all four.
Yes, if you have, you can't even if you try to do it on, you guys talked about like powder boards and sliding boards and all that in mobility, right?
Oh, yeah.
Okay? Is that a true test then, if you think about it? Is it a true test for gravity eliminated? Because what's helping them now?
Board.
The board, all right? The powder board or the slide board is helping them now, all righty? Because it's frictionless, so it's going, woo, all righty? No muscles, all right? You start the motion, momentum's gonna take over, can possibly take over. Yes or no? Okay. Joseph, you said you've had shoulder surgery, right? Is your neck okay?
It doesn't have that much range.
Somebody else? Come. Come on. Somebody needs to come up.
Kevin.
Oh, Kevin, okay, Kevin wants to come up. Okay. Alrighty.
She was like,
Don't worry about pelvic elevation except the muscles that's responsible for it, okay? And what muscle is that?
QL.
Your quadratus lumborum.
Wait, when you asked them to, oh no, that was the lower half of the rectus abdominal. Never mind.
Alright, so when you are talking about neck lateral flexion against gravity, what position?
Sideline.
Sideline, okay, so any particular side. Alright, so go right sideline for him. Which one am I testing now? Left scalene and
SCM.
SEM. Right, what? Is the posterior part of the muscles working too? Possibly? Yeah. Alrighty, so, thing is, you should have them in a much as neutral position, okay? So can you bring your head back a little bit to me? No, not the trunk. Not the trunk, just the head, okay. Alrighty, is he in midline?
No.
You guys, alright, so I will give him either a small pillow, okay, lift up, okay, a little bit better, okay, alrighty, again, like I said, they want a pillow, I'm gonna give them a pillow, okay, if they look distressed. I am gonna be in the back, alright, to see how he's doing, so what would my instructions be? Yeah, bring your left ear to your shoulder. You want him, alright, can you bring this on, yeah, this one, put it like here, okay? Because you want cervical spine, thoracic spine, lumbar spine, to sacrum and pelvis in a nice alignment, alright? So you always want to check, okay, that they're in nice alignment. They're not, in a fetal position or anything like that, alright? So on the count of 3, can you just bring your left ear to your left shoulder for me, please? On the count of 3, 1, 2, 3. Go. Good. Alrighty. Up and
Don't
put
rotate.
it down. Okay. Do you guys see that?
Yeah, he rotated.
Yeah, he rotated. He rotated on purpose too. Just bring your left ear to your left shoulder.
I felt like I wasn't in alignment.
Okay. Just do it. Just bring it up. 1, 2, 3. 1. Good.
Keep rotating,
Alright,
bro.
he's rotating on purpose. Put it down. Okay.
Yo, look at us and then just.
Yeah. Okay.
Alright.
Look at them. Look at Josh. Okay.
Yeah.
On the count of 3. 1, 2, 3.
Joshua who?
Good. He's still doing it. Hey, that's fine. Okay, we'll move on from that point. Alrighty. If I want to palpate the muscles, where would my hands go?
Like,
On the side, and be aware. Is this a position of compromise when you stick your fingers there?
Very much so.
Yes,
Fingers on.
okay, people don't like it, because what's here?
Tricky.
It's tricky, people don't like it, alright? So what you wanna do, 1 or 2 fingers, depending on the size of your fingers and the size of the neck, okay? So you just wanna put it there, and you're probably gonna end up pulling your fingers back a little bit, so out of the way as he's doing the motion, right? Because people just don't like it, alrighty? So I'm gonna place my hands here, okay? So on the count of 3, you're gonna do it 1 more time. 1, 2, 3. And he's really focusing on it now.
There you go.
Okay? And bring it back down. Okay, so that is against gravity. Alright? Now, I do not want you guys to start adding resistance now to this. Okay? Because it's, you know, it can be
Weird.
troublesome.
It's iffy.
Alrighty, when you guys start adding resistance. Alrighty? What I will ask you guys on the practical, tell me where would you place your hands for resistance?
On their head.
Temple, okay, right above the ear, okay? Alrighty, well, cause I just don't, it's troublesome when you guys do that, okay? So if you're gonna add resistance, you're gonna add it right here. And you could actually practice with your hands there, but I don't want you guys actually pushing on his neck, on each other's neck, okay? Alright, alright, so if I was gonna do gravity eliminated for left lateral flexion, where would I put him?
Left side line?
Supine.
Supine.
Oh. Oh,
Supine?
gravity eliminated, yeah.
Yeah,
Sorry.
gravity eliminated, supine,
Thought it was
okay?
against gravity.
Alrighty, most people don't like being in prone that much. Can you test it in prone? Probably, alright, but just people don't like it, okay? So supine is a better position, so can you go supine for me? At this point, for the gravity eliminated, you really don't want him to have a pillow unless they really beg for one. Alrighty. Alright.
Big.
Alright. Can you sort of bend your knees and come towards me to the top of the bed? Alrighty. Alright. Can you come a little more as long as you're comfortable? Okay. Alrighty. So I'm gonna do a quick check. Make sure his cervical spine is in line, okay, with the rest of the thoracic and lumbar spine. And I'm gonna just slightly support him, right? And when I'm supporting him, he really doesn't need a pillow because, you know, the width of my hand is giving him that proper alignment. So I want you to slowly bring your left ear to your left shoulder for me, please. On the count of 3, 1, 2, 3. I'm just gonna go with him, okay? And back, alrighty? Alright, now, what if I want to palpate? Where would my hands go again? Same place, okay? You okay? Alright, I'm just gonna support him with one hand now, alright? So I'm gonna ask you to do the same thing, and again, I'm gonna move my fingers out of the way. We're gonna do this side so they could see, okay? Switch it. Alrighty, so I'm gonna place my hands right here, alrighty, and I'm gonna ask him to bring his right ear to his right shoulder now. On the count of 3, 1, 2, 3. Alrighty, get it out of the way a little bit, and back. Good. So this is gravity eliminated, alrighty, for lateral flexion, right and left, okay? Depending on which side you're going. Alright, so what's next? Flexion, right? Cervical flexion,
Yeah, again.
okay? What position? Well, it says
Supine.
supine. Supine, okay, because this is an against gravity position. Alrighty, I'm gonna support his head a little bit, alrighty? So what would I ask him to do?
Bring your chin to your
Chin
chest.
to your chest.
Can you bring your chin to your chest for me, please, on the count of 3, 1, 2, 3,
Like you're transferring a T.
and
No.
back.
C3.
Alright, good. Alrighty, now we're gonna do it one more time, okay? Alright, and I'm gonna palpate for his muscles. Alrighty, so what I'm gonna do is, you're gonna need to do it twice to make sure both muscles are working. So I'm gonna have one hand here, alrighty? So on the count of 3, do it one more time. 1, 2, 3. Good. Alrighty. Okay, come on down. Can you do it one more time for me? 1, 2, 3. Good. And bring it down. Okay. Now, if I was gonna add resistance, where would my hand be? Alrighty, frontal. Okay, right here. okay? Again, right, you place your hands there, don't play with it, don't play with each other's necks, okay, by adding resistance. Yes or no?
Yes.
Okay. What would be for gravity eliminated?
Sideline.
Sideline. Which one do you wanna go?
Right.
So go right sideline so they can see. Again, you wanna make sure, ooh. Alrighty, I'm gonna support him, okay, keep your hand, drop your hand, okay? Alrighty, making sure cervical spine, thoracic spine, lumbar spine is a nice alignment. Go forward just a drop, hold on to the bed, okay? Alrighty, drop it in my hand. Okay, again, how do you know it's actually in in your hand? It's heavy, and it's not that heavy, so just try to relax as much as you can, okay? Now, people do find this hard to relax, why?
They're scared.
Yeah, they're scared.
Well, if
I'm
you-
holding his neck,
yeah, 'cause
yeah, I'm
if you
holding
let
his neck
go-
here. Yeah, it can, and it's not, yes, holding his arm or his foot, yeah, people don't like that either, but the fact is, this is his neck. So that's why I don't want you guys. So, on the count of 3, can you just bring your chin towards your chest again? 1, 2, 3. Good. And bring it back. Again, I'm gonna look for any compensations or look for decreased effort in doing this. Because again, when we use our cervical muscles, right, when we're all holding our head up right now, okay, is it all muscles 100% against gravity when we have our head up like this?
No.
No, it really depends on what we're doing. Now, if again, I need to palpate for the muscles, alrighty, so on the count of 3, relax in my hand. Okay, there you go, alrighty. On the count of 3, bring your chin towards your chest, 1, 2, 3, and back, alrighty. I'm gonna test the other one, so people don't like that, okay. I'm gonna just switch it here, 1, 2, 3, and I'm gonna get my hand out of the way. Yes or no? Good? Alright, you wanna lay down and let me go check. No, don't put your head like that. Just relax for a minute. Either, go supine or something. Go supine. What's next for me? We did cervical flexion,
Lateral
against gravity, gravity eliminated.
Flexion and rotation.
Hyperextension. Ooh. Oh, and neck lateral flexion and rotation. Okay, alrighty. This is good. Alright. So we're looking at, bring your head just
Come on,
a
see
drop
how
off
beautiful it is.
Okay.
See it?
Alrighty. Okay, so when we're looking at neck lateral flexion with rotation, what muscle are we looking at?
Oh, I see him.
SCM. Okay, so if it is my right SCM,
Oh,
okay,
go to the left.
what's he gonna do?
To the left.
Right rotation or
Left
Right.
rotation.
left rotation? Okay, so you're gonna ask him, okay, we're looking at our right SCM, okay? Alright, can you bring your right ear towards your right shoulder for me? Right, now look over my left shoulder up here. Left. Alrighty,
Whoa.
and what you can see is SCM coming into play right there. Yes or no? Okay, come back, we'll try it again. Alright, so bring your right ear to your right ear to your right shoulder for me. Alright, now turn over and look over my left. Alright, his SCM pops out. Alright, SCM does contralateral cervical rotation, ipsilateral lateral flexion.
Whoa. Can
Okay.
you please repeat that, please?
The same thing. What is it?
Contralateral.
Contralateral,
rotation.
what does that mean?
Other side.
Other side.
Other side,
rotation.
ipsilateral, what does that
Same
mean?
side.
Same
Neck
side,
flexion.
and that's all that means, okay?
No, I know, but I just
Yeah,
would love to
that's
hear it
all
again.
that means, okay? Know those words because that's what they're gonna use. Unfortunately, they're gonna use those words on your exams, on your national exams, okay? Contralateral means, contra always means opposite. Ipsi,
Same.
same, okay? So just keep that in mind. Alright, so if we wanna do his left now, I would tell him, bring your left ear over to your left shoulder and look over my right shoulder, okay? So on the count of 3, 1, 2, 3, and look over your left shoulder, right shoulder. See that coming out, right? Very easily. Alrighty, his pops out very good. Okay? Good? Alrighty. Now, scooch back, put your head on the bed, okay? Alright, now looking at this motion, alrighty, doing it gravity eliminated, is there any way what we can sort of get him in a gravity eliminate position to test it safely?
Sitting.
You could try sitting,
Isn't that kinda
but
with
what
gravity?
muscles are we actually looking at? What muscle are we looking at again?
With the
SEM. Can we look at the SEM for its actual strength in a different test? Yes or no, you think?
different tests.
Right? What else does the SEM get to do?
Lateral
Flexion.
flexion.
Lateral flexion. So you can test the SEM, okay, for any weaknesses by just doing the lateral flexion component alone and gravity eliminated. Okay? Because it's hard to really sort of test it, righty, combining both. Okay? What I want you guys to see is looking at when you do, righty, because when people say, you know, somebody's calling your name, what do most people do? If you're standing, you go, what?
SEM.
Yeah, SEM, come over here. You're gonna turn your head and rotate a little bit, right? Alrighty? You're not, most people don't do that, well, people do this all day long. Yeah? Oh, okay.
Oh, yeah.
That was a good
Okay.
one. God damn it. Just hate him.
Okay, yes, people in the office who's on the phone, they shouldn't be doing that. Especially with the, depending on you. But yeah, when you're on the phone, yeah, phone people, actually, yes, phone people do that all the time. They don't put it on the speaker or
So bad.
whatever. Okay, but looking at that, okay, you're gonna be testing just using against gravity position, okay, for neck lateral flexion and rotation. You're only gonna be testing the against gravity position. What do you think I would be doing if I was gonna add resistance? Yeah, just stay right there, okay? Alright, left, and look over my right. What would I be doing?
Like pushing
Yeah.
like down.
Okay, I would be.
Kind of like with
Yeah.
wrist flexion, you have one hand on
Twist.
one side and then
Uh-huh.
one hand on the other side.
What's that called? Would people like me to do that kind of thing? No. Okay? Do not want you guys to practice that maneuver at all. Okay? Okay? If we actually needed to test the strength of the SEM and the scalenes, by the way, you were doing it separately, not together, not one of these things. Okay? On people's neck. Yeah, you need
We
some.
have a ruler I can borrow.
You want a protract? You want a goniometer?
No, well, I guess we could use that. We're doing forward reach tests.
Yeah. We have, do you want tape measures?
I could have swore I had a
I
read.
think we could do that. Yeah, that's good.
You want to, okay.
Maybe I'll do the tape measure. It's not ideal, but.
But I don't know what's the thing we want to get. Yeah, ruler.
She just said that we have to avoid?
They're making fun of you, bro.
What did she just said that we have to avoid?
Dude, the thing is so hard.
What thing?
It requires so much concentration.